experience training for an athletic activity or a race, some kind of venture. All right, pretty healthy crowd here. I was training for a race last year at the same time I was conducting this research that I'm here to talk with you about today with Saatchi Wellness on women, wellness, and technology. This was the technology I was using to track my own training. It's a little ironic, but it turns out I'm not that unique. We set out to understand how women perceive wellness and the role technology plays in their well-being. And after connecting with close to 200 women, we uncovered this dichotomy between what women asked of technology and its potential to add true value to their wellness. And this dichotomy, this well-tech dichotomy we're calling it, is driven by three key factors. One, how women perceive wellness. Two, the central role social relationships play in their well-being. And three, the emotional relationship women have with tech itself. So first, we learned that women compartmentalize health and wellness. A participant told us that she associates health and healthcare with this whole world of medicine, whereas wellness to her was the steps that she took outside of having to go to the doctor. Health to women is black and white. It's answers to concrete measures, physical measures, whereas wellness is holistic. It's this ideal balance, this sense of stability amongst the physical, emotional, and mental components of their lives. And by defining wellness in this way, we also learned that wellness is more challenging for women to manage than health. Another participant told us, I'm not going to go and do exercises for my sensitivity because, to my knowledge, there's nothing that's prescribed. Which leads us to our next key finding, that instead of going to the medical community for wellness prescriptions, women rely on their social community as this driving force behind their well-being. In fact, we learned that women are more likely to turn to their peers than their physicians for wellness advice. And this was in large part due to the fact that women were a little worried, that their physician wouldn't be able to relate to the emotional and mental components of their wellness. So that puts their personal relationships in this driver's seat, not just in information seeking, but in motivating wellness behavior change. Women overwhelmingly told us they were motivated to invest in their own wellness when they saw the benefit that investment had in the other people in their lives. A participant told us, I'm a much better parent. I am a better friend, spouse. I'm better at managing the roles society puts on me when I put in the work of managing my own wellness. Women also overwhelmingly told us that they were motivated by supportive relationships, not competitive ones. And this is in contrast with a lot of the gamified tech engagement experiences we see in the marketplace today. So this disparity between how women want to connect with others and how they engage with tech brings us to this third and final key finding in our dichotomy, that women have an emotional relationship with tech itself. And it's a complicated relationship. Whether they were 25 or 65, we learned that tech evokes a wide range of emotions in women, from the joy and gratitude in, I love you phone, we heard that, to the guilt inherent in, I hated seeing red, I failed to reach my goal. I mean, how many of us have shaken the Fitbit at the end of the day to avoid that feeling? That's a demotivating experience for women, and it makes this a complex relationship with technology. We saw this relationship show up more broadly when we observed this wide gap between the high level of awareness and low level of use across a wide range of technology, wellness technology categories. This is the dichotomy that we're talking about. This is the gap that we want to close, because we know that women are 50% of our patient and consumer populations. They make 80% of family healthcare decisions. And we also know they've been historically underrepresented in research and tech innovation. And to be honest, women are kind of skeptical of us too. A participant in her 30s said this better than I ever could. She told us, "For as much of my life is digital, so much of wellness for me is human interaction with other people. And that experience with a device isn't something that's really out there." Thankfully, some of the insights that we learned can guide us to designing better experiences for women, and with three main directional pieces here from this research. We need to, one, help women close the gap between how they manage their health and their wellness. We need to, two, champion supportive social relationships, not competitive ones. And three, create tech that evokes positive relationships with the device, not negative ones. Because at Saatchi Wellness, the organization I'm here supporting, really believes that humans are motivated, that we're motivated when we feel something. And by feeling something, we're motivated to do something. And I'm excited, we're excited to continue learning and collaborating and creating. So let's go surprise her. Thank you.